What is a midwife? Canadian edition, mainly based off of Ontario context. There are many midwives around the world. Generally, midwives are people that work in partnership with pregnant people and newborn babies. They provide care and counseling during pregnancy, labor, birth, and the postpartum period. So many midwives take care of pregnant people through their entire pregnancy journey. However, there are differences between the definition of a midwife in the country where you live versus a midwife in the country that another person lives in. This is because midwives have different scope of practices. The scope of practice is the procedures and actions that midwives are allowed to do in their care. Let's bring this to the Canadian context. Welcome to History Lesson 101. Midwifery has been present in Canada for centuries. Long before the settlers came to Canada, there have been many Indigenous midwives that worked in many Indigenous communities. When medicine and clinical research for pregnancy began to thrive in the 1700s, there were more interventions made during childbirth, and many midwives were phased out of the system. However, many fought back against the decision to eliminate midwives, and the government decided to regulate the profession. It wasn't until 1994 when midwives were legally regulated in Canada. At first, Indigenous midwives had to work under an exemption clause, and it wasn't until recently that they are publicly funded. Ontario is the first in Canada to have midwifery regulated in 1994. British Columbia and Alberta had midwifery regulated in 1998, Quebec in 1999, Manitoba in 2000, Northwest Territories in 2005, Saskatchewan in 2008, Nova Scotia in 2009, Nunavut in 2011, New Brunswick and Newfoundland in 2016, Yukon is planning on regulating midwifery soon, and PEI still does not have midwifery regulated as of early 2018. Currently, midwifery is publicly funded in most provinces, but not all. In Canada, when a person is pregnant, they have the option to choose to obtain care from a midwife, family doctor, or an obstetrician as their primary healthcare provider for their pregnancy. Now, not all family doctors will choose to attend births, but some do, so check with your family doctor before you choose who you want to receive care from. All three of these healthcare providers are professionally trained to follow clinical guidelines from the Society of Obstetricians and Gynecologists of Canada to ensure the safety of the pregnant person and the baby. All three of these healthcare providers are able to prescribe pregnancy-related medications and write requests for special procedures such as ultrasounds and blood work. Family doctors and obstetricians have wider access to non-pregnancy and pregnancy-related drugs and diagnostic procedures. But having a midwife does not lower your chance of gaining access to these drugs or procedures. Your midwife will be able to schedule a consult with the obstetrician, or in some cases, the midwife and obstetrician will have shared care. In other situations, a transfer of care to an obstetrician will be suggested by your midwife. If you're a Canadian citizen, or if you have a Canadian government-funded healthcare insurance, in Ontario this is called OHIP, a midwife, family doctor, and obstetrician is free for you. Certain procedures, lab tests, hospital stays are also free. If you are pregnant and do not have this insurance, midwifery care is the only healthcare practitioner that is free of cost for you. However, you will have to pay for lab tests, certain procedures, hospital stays, or obstetrician consultations. So, they seem to do similar things. What makes a midwife different? 3 beliefs that make midwifery a unique profession include continuity of care, informed choice, and choice of birthplace. Continuity of care. It is important to midwifery care that you see the same person or group of people for your entire pregnancy journey. Midwifery care will begin as early as 8 to 10 weeks of pregnancy and continue until 6 weeks postpartum. Midwives will be there for you on your delivery date to catch your baby or be with you in the hospital in the event complications arise. Midwives are on call 24/7 through a pager system and work in teams to provide personalized care to their clients. Informed choice. It is part of the midwife's role to provide information and education in order for the client to make proper choices in their care. Choice of birthplace. The third very distinct feature of midwifery care enables you to give birth at a nearby hospital, your house, or a birth center, if you have one in your area. Next, let's talk about some differences. Midwives are not doctors and did not go through medical school. Similar to doctors, midwives undergo 4 years of school. In addition, many midwives have already completed at least a previous undergraduate degree. Secondly, midwives nor family doctors can perform cesarean sections. Only obstetricians are able to conduct cesarean sections in hospitals. Third of all, a midwifery appointment is usually between 30 to 45 minutes. A family doctor is generally 10 to 15 minutes, and an obstetrician's appointment is around 5 minutes. Of course, this is not always the case, but generally a midwife's appointment time is longer. Midwives in Canada are also not nurses. Not that they can't be, but you don't have to be a nurse before you become a midwife in Canada. A labor and delivery nurse usually works alongside obstetricians, but their role includes, but is not limited to, things such as monitoring you and your fetal heartbeat, contraction length and strength, administer medication, provide coaching and support to the pregnant person before birth. In addition, they are great facilitators for newborn and child support after birth. Midwives also perform many of these roles that are listed. Midwives are also not the same as doulas. Midwives are clinicians that are responsible for the clinical care of you and your baby and are funded under the government. Doulas are non-medical people that care for you before birth, during birth, and after your birth to provide emotional support and physical help if needed. Doula care is not funded by the government, so you will have to pay for these services. Doulas, labor and delivery nurses, obstetricians, family doctors, and midwives are all equally amazing people for your pregnancy and birth. All of these professions have established good relationships for you to have the most positive pregnancy and birth experience possible.